Dr. Elkhammas. I'm Professor of Clinical Surgery at The Ohio State University. What I selected for you today is really a nice article that was published recently, actually in January of 2015 in the New England Journal of Medicine. There are many authors who authored the article on behalf of the donor network. The title of the article is Gestational Hypertension and Preeclampsia in Living Kidney Donors. We do a fair amount of kidney transplants where the donor come from a living donor, either a family member or a friend. Could be a father, mother, sister, and so on. But the article for today is concerned a subgroup of living kidney donors, and that is the young females who are interested in pregnancy after kidney donation. They do ask such question all the time. I am going to get pregnant in a couple of years, or I'm going to get married, starting a family. Would giving my kidney to my relative affect my future pregnancies? And it is a really very important question. It's difficult to answer this question by prospective study. However, it was tackled before, I believe in 2009, by a nice article from Minnesota, and there was another article from Norway. These are probably the main two articles people have been citing, and now added the third one that was the one I selected for you, and it's titled again Gestational Hypertension and Preeclampsia in Living Kidney Donors. And in this article, the authors looked at 85 women who donated kidneys, and they followed them up for 131 pregnancies. They did select a match group of young females who are non-donors. They selected in a ratio of 6-1, so for every female donor they selected 6 non-donors, and the end result regarding the parameters that the authors are looking for, it turned out that in the donor group there were 15 events, which come up to about 11% of the pregnancies have either preeclampsia or hypertension, gestational hypertension, versus 38 events and 788 pregnancies, and that is 5% in the non-donors. The odd ratio turned out to be about 2.4, with a nice 95% confidence interval ranging between 1.2 to 5. I mean, the risk is about 20% higher, all the way to 5 times compared to the non-donors. And even when they looked at the components of the primary outcome, they saw that there was more common gestational hypertension by itself among the donor, and more common preeclampsia among the donors. However, the other events, which are common questions too, whether if there is any increase in the preterm birth, and in both the groups they were very similar. In the donor group was 8%, and the non-donor group was 7%. And if there was any low birth weight, they found it in the donor group about 6%, and in the non-donor group about 4%. So in their conclusion, the authors felt that gestational, I'm reading the exact conclusion from the abstract of the paper, that gestational hypertension, preeclampsia was more likely to be diagnosed in kidney donors than in matched non-donors with similar indicators of baseline health. This study was funded by the Canadian Institute of Health Research and others. And back to the original question, how would you answer such donor from the ethical standpoint? I think probably the potential donor should be informed of this increased risk, but I don't think this should decrease the number of donors because there is no really clear association, and there are many factors and many deficiencies and probably shortcomings of any retrospective study we do. So they really did not look into the, for example, the racial differences among the group. They didn't look into the BMI in this particular article. And in general, I think the kidney donation is really very safe, and it's ethical to continue practicing it, but it would be advisable to whether the patient asked or did not ask, or the potential donor, whether they ask or they don't ask, they should be really volunteered this information. I would be really interested if any other professionals comment or the general public comment on this. What is their opinion about discussing it with the patient when the patient didn't ask the question? I want to thank you so much for listening, and hopefully we'll see you in another recording and a different article. This article is from the New England Journal of Medicine that was published in January of 2015, titled Gestational Hypertension and Preeclampsia in Living Kidney Donors. Thank you again.